How can someone be bright, articulate, even college capable, and still not be able to live independently? Hi, I'm Dr. James Thatcher. I'm a licensed clinical psychologist at Forest Psychological Clinic in Portland, Oregon, and I've done over 2,000 comprehensive autism evaluations. And I've seen this sort of pattern happen time and time again, especially with young adults who look fine on the surface until those supports underneath disappear. In this video, I'm going to help you understand what level 2 autism actually means in real life and why it's so misunderstood. So we're going to do several different things in this video. I'm going to translate the DSM language, connect it to daily living and executive functioning issues, and I'm going to anchor all of this with a 2026 CDC data set that talks about how the levels are used and how they're documented. So let's start here. Let's start with the DSM-5 TR. And let's talk about what the different levels are, right? So level 1 is requiring support. Level 2 is requiring substantial support. And level 3 is requiring very substantial support. And those levels are based off of support need. And they fall under 2 domains. The first domain is social communication. The second domain is restrictive, repetitive behaviors. So that's talking about rigidities, difficulties in being able to modulate routine. And before I continue with this video and talk about the various levels, especially level 2, I want to make this very clear to where support needs are not a ranking of someone's value. Rather, it's a way of naming what does this person need in order to communicate, in order to function, in order to regulate in daily life across settings. So let's get into the research a little bit and talk about why these levels are so confusing. And I see these in the comments all the time on how some folks just don't get a level. So in 2026, there's an open access paper in the Journal of Autism and Developmental Disorders. And I'll put the information down below in the description for this specific paper, and I'll also probably put up a graphic of it here in just a second. So what this study did is it looked at CDC autism surveillance data. And one of the big findings that came out of it was that 40.4% of anyone who got a diagnosis of autism had some form of level attached to it. And what they also found is that attaching a certain level varied wildly by region. I'll get into that here in just a minute. And among the records that were included in this data set, level 2 autism was the most common one that they found. So what was the N? What was the population that they looked at? So they had 15,450 children participate in the study. So any children with an autism diagnosis that was on file with the CDC at that time. And what they found was pretty interesting, to where having any sort of level associated with them varied wildly by region. So to give you an extreme example, 4.8% of the children who lived in New Jersey had any sort of autism level attached to them, compared to California, which had 73.2%, meaning out of all the children in California that were diagnosed with autism, 73.2% of them had some level attached to the diagnosis. And they also found who gets these levels documented. I'm talking any sort of documentation on the levels of autism, level 1, 2, or 3, in order to determine and help with support needs. And what they found is that 4-year-olds had a 48.6% chance of any kind of level being documented, versus 8-year-olds, there was 33.7% of them had a level documented. And there was a difference based on race. So where with Black children, anyone who was diagnosed with autism, 31.9% of them had any sort of documented level attached, compared to white children who had a 43.5% rate of having a level attached to their diagnosis. Now let's get to the heart of the matter and why I'm bringing all these different variances up on how it relates to level 2. Among the kids who did have at least one severity level documented, So out of that 15,450, 6,247 of them had something documented. Level 2 was the most common rating across domains. One more detail for you nerds out there, just like me. Out of those 6,247 children who had any sort of level attached to their documentation, 33.2 of them had a level attached without specifying the domain. Remember earlier when I talked about how there's two domains that we look at, social communication and then restricted repetitive interests or restricted repetitive behaviors? Because what you're supposed to do as an evaluator is to put the level of support need on those two different domains, right? So someone could be a level 1 with social communication, be able to have reciprocal communication, talk back and forth, but they could be a level 2 when it comes to restricted repetitive behaviors. So if you've ever felt, wait, why didn't I get a level? Or thought to yourself, well, why is this so inconsistently applied? You're not wrong. Even in real world systems, levels are not documented consistently. It doesn't mean that levels are useless. It means that we have to use them in the way that they were intended, as a shorthand for support planning, not as an identity stamp. So now let's talk about these two different domains that I've been bringing up and what it can look like for folks who are more level 2, requiring substantial support. So the first one is social communication. And the DSM describes social communication not as, well, can you talk to other people? It's more like, can you initiate a conversation? Can you respond in a back and forth conversation? Can you handle the hidden rules in social life? Tone, timing, flexibility, even while under stress. And can you do that across settings? Not just in one particular place, like not just at home or not just at school. So let me share some examples of you. And I've been seeing this a lot here lately to where I'll have a family bring in a young adult and cognitively they're average. Sometimes they're above average, but there is a big gap between their IQ and their independent functioning. It's where they don't have a job, they don't have any interview skills. They may have attempted college or maybe haven't gone to college yet. And they require constant reminders in order to engage in daily living tasks around the home, like doing chores or even engaging in sort of in self-care, taking a shower, brushing their teeth. They still need reminders in order to do that. And one of the clarifying questions that I have for them, sometimes I'll phrase it this way to where if your parents went away for 20 years, like if they went and lived on the moon for 20 years, would you be able to make it on your own? And if the answer is a quick no, I take that seriously. Not as that they're being lazy or that it's a moral failure of theirs, but I take it as data. Their support needs are substantial. Daily living, executive functioning, social navigation, those systems aren't self-sustaining yet. And a comment that I sometimes hear from parents is, well, they had friends when they were younger, but then that's when I slow down and then I start asking some more questions. And then what we start to realize is that social life existed when they were younger because the parents set that up. They were the ones that was scaffolding everything. So maybe they were playing with their cousins or different family friends, and it was in a structured environment. Again, these things were set up for them. They were not the ones that were initiating. And then as life goes on, social situations get more complex. So it gets confusing. They don't know what to do, what to say, how to initiate, how to maintain those relationships. And that just gets substantially harder. So now let's talk about what level 2 actually means in practice. I'll get to that second domain here in just a minute, but what does level 2 actually mean in practice? When I diagnose level 2, I'm not thinking to myself, how autistic are you? What I'm thinking to myself is, what supports do you need in order to make your life workable and sustainable? And a huge part of this is about daily living. And I base that off of the history that I'm getting from them, their collateral information like their parents, and from adaptive measures like the ABAS that I've talked about in other videos. And basically what I'm looking at is, how does life work at home? How does it work in the community? What do routines look like? What is their hygiene schedule or routine look like? What about meals? What about transportation? Are they able to drive on their own? Do they need other folks to drive them? Are they able to figure out public transit? I'm also looking at time management, and I'm looking at follow through. So when we're talking about level 2 support, I'm looking at all those areas to where all of those areas require substantial support. And what that can include is some sort of communication support, so learning and practicing pragmatic communication, so real world back and forth conversations. And of course, executive functioning supports. So organizing things, planning things out, executing them, starting tasks, finishing tasks. So someone might be smart, they might speak well, they might have some insight into what's going on, and need substantial support in order to build a functional life. Let's talk about that second domain. So restricted and repetitive behaviors, which includes rigidity, inflexibility, being able to shift gears between different tasks, or not just that, being able to shift attention or plans or methods of doing things. So in the DSM, it gives a description on what could fall under this domain of level 2. And the language in there is talking about how the inflexibility is frequent enough to be obvious to the casual observer. It also interferes with functioning across settings, and that any change in that routine can create a lot of distress and just kind of derail the day. So, and clinically, I see this a couple of different ways. Pattern A is, I'm not doing it that way. So let me give you an example of that. With this one, parents are often trying to coach, right? How to fill out an application, how to do a specific task, how to do a certain chore in the house. And then the person gets stuck on a certain method on how they want to do it, right? No, I'm not going to do it this way. I'm going to do it my way. And usually how this shows up is not in a playful, preferential way, like, oh no, I prefer to do it this way. It's much more rigid than that. So where this rigidity, it blocks any sort of learning. They can't be flexible if things happen a different way, and they're not able to modulate it. They have to use the same method, even if the situation is starting to call to do something different. So basically, they're not adapting to the situation that's in front of them. Another pattern that I see is that if there's a schedule change, then there's a system collapse that happens. And this one's huge. When you meet an autistic person, you did just that. You met one autistic person. So not everyone is exactly alike. But here's kind of a clinical distinction that sometimes I use. So a level 1 person, when there's a change in the schedule, they might say to themselves, okay, I don't like this, but give me a minute and I'll adjust, right? It's still distressing. It still brings up anxiety. It still brings up stress, but they take a beat and they can readjust. Whereas with level 2, the schedule has been built up in their head, just like, folks that are on level 1. But when that goes away, everything collapses. And then they're not able to replace that with anything else. So it's not a won't, it's that they can't without some sort of external support to help them. And what that looks like when the schedule changes is that they might freeze, they might shut down, they might have a meltdown, and then they lose the entire day. And they need somebody else to step in to help them regulate and help them plan. Okay, well, since we can't do A, maybe we can choose B, C, or D. Like we can do any of these other options. And another pattern that I see in folks with level 2 that falls under this domain is restricted repetitive behaviors are hard to mask. So yes, sometimes motor stereotypies or stimming, it's a lot harder to suppress, especially when folks are under stress. And I also want to say this to where there's nothing wrong with stimming. Often it's a form of self-regulation. But in the DSM, the phrase obvious to the casual observer means quite a bit because it changes how environments respond. It changes how the workplace, how schools, how when folks are out in the community, how it responds to that individual. And if the environment doesn't understand it, that person can get misread or mislabeled or judged. And when that happens, stress increases. And we all know when stress increases, it exacerbates everything else. So, part of level 2 support is not to stop stimming, it's to reduce the overload, the social overwhelm that that individual is experiencing, and to build environments where the person doesn't have to constantly fight their own nervous system. And here's the most important part: levels are not fixed forever. I talk about this to families all of the time, especially if I'm working with a younger kid or a teenager or parents who are worried about their young adult who has a failure to launch. I tell them this all the time. Level 2 is based off of support need right now. That doesn't mean that they're going to be a level 2 for the rest of their life. If they're able to get the support that they need and be successful, they can always go from having level 2 autism to level 1, because again, it's based on support need. And I've absolutely seen that. So where if someone who has level 2 autism, they're able to get the extra support, they're able to get therapy, they're able to get some extra support with executive functioning, so how to plan things out. I have seen folks move from level 2 to level 1, and not because they became a different person, but because the environment for them got better. They were able to learn and utilize more supports, and the skills that they were able to learn became more reliable over time. And honestly, that's the whole point of doing these diagnoses, of doing these evaluations and doing them well and being able to document them according to the DSM, not to give a label to folks, but to give a roadmap on how best to support them. So if you're an adult watching this and you think that you might have level 2 autism, I want you to hear this part. Support needs are not your worth. They're a description of what your life demands and what your nervous system needs right now. And if you're a parent watching this and thinking about your child, that they might be more level 2, you might be feeling some anxiety. You might be even feeling some fear right now and thinking to yourself, is my child going to be okay? And that makes sense that you're thinking that question. And the goal is not perfection. Perfection is never obtainable. The goal is to build a life that's stable, supported, and workable for them. So if you like this video, please stick around for the next one. I hope that you'll enjoy it. All right, I'll see you there. Bye.